Welcome to Lux Scout Psychology. The Invisible Burden Introducing Somatic Symptom and Related Disorders. Beyond physical sensations, the mind-body connection. Unveiling the spectrum, a closer look at somatic disorders. Somatic symptom disorder, when physical symptoms take center stage. In the age of readily available medical information online, it's not uncommon to feel a twinge of anxiety when we experience an unfamiliar ache or pain. Imagine experiencing a sudden loss of vision, paralysis in a limb, or seizures that defy medical explanation. Factitious disorder, sometimes referred to as Munchausen syndrome, presents a unique and complex challenge in the realm of somatic symptom and related disorders. While the experience of somatic symptoms and related disorders is deeply personal, influenced by an individual's unique life history and circumstances, research suggests that genetic and biological factors also play a role in shaping vulnerability to these conditions. While genetic and biological factors lay the groundwork for vulnerability, it's often the weight of our experiences, both psychological and environmental, that tips the scales towards developing somatic symptom and related disorders. Understanding the causes and risk factors of somatic symptom and related disorders is not about identifying a single culprit, but rather recognizing the intricate tapestry woven from threads of genetics, biology, psychology, and environment. The diagnostic challenge: navigating the complexities of somatic symptom and related disorders. Diagnosing these disorders is like navigating a labyrinth, requiring careful consideration of physical symptoms, psychological distress, and medical history. Symptoms can mimic many conditions, leading to numerous tests before considering a mental health component. Patients often seek medical explanations impacting their daily lives. Standard tests may not reveal a physical cause, causing frustration. Co-occurring conditions add complexity, blurring lines between physical and psychological factors. Stigma around mental health can make patients hesitant to consider psychological factors. Empathetic communication is crucial, emphasizing that distress is real and seeking help is a sign of strength. Unraveling the threads, a comprehensive approach to diagnosis. Reaching an accurate diagnosis of a somatic symptom and related disorder requires a comprehensive and collaborative approach, involving open communication between the individual, their primary care physician, and often a mental health professional. It begins with a thorough medical history, including a detailed account of the individual's physical symptoms, their duration and severity, any previous medical diagnoses, and family history of medical or mental health conditions. A physical examination is equally important to rule out any underlying medical conditions that may be contributing to the symptoms. This may involve blood tests, imaging scans, or referrals to specialists, depending on the nature of the individual's concerns. While it's essential to rule out medical causes, it's crucial to remember that a lack of medical findings doesn't invalidate the individual's experience of their symptoms. Once medical causes have been ruled out or addressed, a mental health evaluation is often the next step. This typically involves a clinical interview with a psychologist or psychiatrist to assess the individual's psychological and emotional state, exploring potential stressors, past traumas, and coping mechanisms. Standardized questionnaires and assessment tools may also be used to gather information about the individual's symptoms, health anxieties, and overall quality of life. Diagnosing a somatic symptom and related disorder is not about finding a quick fix, but rather embarking on a journey of understanding the intricate interplay of physical, psychological, and environmental factors contributing to the individual's distress. It requires a compassionate and patient-centered approach that prioritizes open communication, thorough assessment, and collaborative treatment planning. Navigating the path to healing, a multifaceted approach to treatment. Treating somatic symptom and related disorders is not a one-size-fits-all endeavor. It requires a multifaceted approach addressing physical symptoms, psychological distress, and environmental influences. The goal is to manage symptoms, reduce distress, and improve quality of life. Establishing a strong therapeutic relationship is crucial. Open communication, empathy, and validation are key. The distress is real, even without a clear medical explanation. Treatment often combines psychotherapy, medication, and lifestyle changes. The approach depends on symptoms, history, and resources. With patience and support, individuals can live full and meaningful lives. Psychotherapy, also known as talk therapy, plays a crucial role in treating somatic symptom and related disorders. It provides a safe space to explore psychological factors contributing to symptoms and develop healthier coping mechanisms. Cognitive behavioral therapy, or CBT, is highly effective for these disorders. CBT focuses on changing negative thought patterns and behaviors. Mindfulness-based therapies teach individuals to pay attention to their thoughts and bodily sensations without judgment. Psychodynamic therapy explores unconscious conflicts and past experiences. Psychotherapy requires commitment and patience, but the rewards can be life-changing. While psychotherapy is often the cornerstone of treatment for somatic symptom and related disorders, medication can play a valuable role in alleviating certain symptoms, such as anxiety, depression, and pain, which often co-occur with these conditions. The decision to use medication is made on a case-by-case basis, considering the individual's specific symptoms, medical history, and preferences. Antidepressants, particularly selective serotonin reuptake inhibitors, or SSRIs, and serotonin norepinephrine. Reuptake inhibitors, or SNRIs, are commonly prescribed to manage symptoms of anxiety and depression, which are often present in individuals with somatic symptom and related disorders. These medications work by increasing levels of serotonin and norepinephrine in the brain, chemicals that play a crucial role in regulating mood, anxiety, and pain perception. Anxiolytics, also known as anti-anxiety medications, such as benzodiazepines, may be used for short-term relief of severe anxiety. However, these medications are typically prescribed cautiously due to their potential for dependence and abuse. Other medications, such as pain relievers or muscle relaxants, may be prescribed to address specific physical symptoms, though it's important to use these medications judiciously and under the guidance of a healthcare professional. It's crucial to remember that medication is not a cure-all for somatic symptom and related disorders. While it can provide relief from certain symptoms, it does not address the underlying psychological and environmental factors contributing to the condition. Therefore, medication is most effective when used in conjunction with psychotherapy and lifestyle changes, targeting both the symptoms and the root causes of the distress. Treating somatic symptom and related disorders requires a collaborative approach involving healthcare professionals addressing physical, psychological, and social needs. This integrated care model recognizes the intersection of mind and body, requiring a holistic approach. The primary care physician coordinates medical care, orders tests, and monitors conditions. Mental health professionals diagnose and treat mental health conditions. They provide therapies like CBT to manage symptoms and develop coping mechanisms. Other professionals, like physical and occupational therapists, may also be involved. Integrated care emphasizes open communication and collaboration for holistic treatment. The path forward. Understanding the course of somatic symptom and related disorders. Predicting the exact trajectory of these disorders is like forecasting the weather, variable and deeply personal. Everyone's experience is unique, influenced by individual, social, and environmental factors. Some may have short-lived symptoms, others face chronic challenges. With appropriate treatment, many can improve significantly. Early diagnosis and intervention are key. Early intervention helps cultivate healing and resilience. Recovery is not always linear. Setbacks are normal and do not signify failure. Adapt treatment plans over time. These disorders are not life sentences. With the right support, individuals can manage symptoms and live meaningful lives. It's a journey requiring patience and belief in a brighter future. Fostering resilience. Keys to a brighter outlook. The path forward may have its twists and turns, but key factors can influence the prognosis of somatic symptom and related disorders. Motivation and willingness to engage in treatment are crucial. A strong support system is invaluable on the road to recovery. Developing healthy coping mechanisms is crucial for managing stress. Regular physical activity, sleep hygiene, and a balanced diet impact well-being. Addressing co-occurring mental health conditions can improve outcomes. Seeking help for mental health is a sign of strength. Understanding for a healthier future. The importance of recognizing somatic symptom and related disorders. As we've journeyed through the complexities of somatic symptom and related disorders, we've uncovered the intricate ways in which our minds and bodies intertwine, how emotional distress can manifest in physical symptoms, and how challenging it can be to navigate these often misunderstood conditions. The invisible burden carried by individuals with these disorders is often compounded by stigma, skepticism, and the frustration of seeking answers in a medical system that sometimes struggles to address the complex interplay of mental and physical health. Yet, by shining a light on these conditions, by fostering open conversations about mental health, and by promoting empathy and understanding, we can begin to dismantle the stigma that prevents individuals from seeking help. Recognizing the very real suffering experienced by individuals with somatic symptom and related disorders, validating their experiences, and providing compassionate care are essential steps in promoting healing and improving their quality of life. Understanding these disorders is not just about memorizing diagnostic criteria or treatment modalities. It's about cultivating a deeper awareness of the human experience, recognizing the profound ways in which our emotions, thoughts, and beliefs shape our physical well-being. It's about acknowledging that the mind-body connection is not a mere philosophical concept, but a fundamental aspect of our biology, influencing our health and well-being in profound ways. Breaking the silence, embracing hope. A call to action for compassion and support. Breaking the silence surrounding mental health, particularly conditions like somatic symptom and related disorders, is not just a matter of individual courage. It requires a collective shift in perspective, a societal embrace of empathy and understanding. It's about creating spaces where individuals feel safe to share their experiences without fear of judgment, where vulnerability is met with compassion, and where seeking help for mental health concerns is seen as a sign of strength, not weakness. We can all play a role in fostering this culture of compassion. Start by educating yourself about somatic symptom and related disorders. Challenge your own preconceived notions about mental illness. Listen with an open heart to the experiences of those living with these conditions. Offer support to loved ones who may be struggling. Advocate for increased funding for mental health research and treatment. Remember, behind every diagnosis is a human being deserving of understanding, respect, and quality care. By embracing hope, by breaking down the barriers of stigma, and by working together to create a more compassionate and supportive world, we can empower individuals with somatic symptom and related disorders to reclaim their lives and live to their fullest potential. Their journeys may be challenging, but they are not alone. Let's walk alongside them, offering support, encouragement, and the unwavering belief that healing and hope are always possible. Please like the video and share it with others. It helps those who are suffering. Thank you for watching.